As we battle COVID-19, some health experts have been taking a closer look at how it impacts people, especially kids. The Centers for Disease Control recently released their findings, and as Jade Cunningham reports, there's some good news.
One question people have had is how coronavirus affects kids. After doing some extensive research, the CDC now has some answers. From February 12th to April 2nd, they looked at almost 150,000 cases nationwide. Only 1.7%, roughly 2,500 cases, involve kids under the age of 18. So what did they feel? While 93% of adults experienced fever, cough, or shortness of breath, the CDC found those symptoms were reported less in kids, about 73%, and that their symptoms were less severe. Still, though, some children required hospitalization. The report states most were babies less than 1 year old and kids who had underlying conditions like asthma. Typically, pediatric cases are mild in the U.S., but still the CDC urges parents to be vigilant because while symptoms are less severe and sometimes non-existent in children, they can still spread the virus to others. Jade Cunningham, Eyewitness News.